You've torn your ACL and surgery is on the table. Here's what actually happens and how recovery works. The ACL is a ligament deep inside the knee that keeps the shin bone from sliding forward and controls twisting movements. When the ACL tears completely, the two ends pull apart and don't reattach. The knee can give way during twisting. Reconstruction is often recommended for active people, those with combined knee injuries, or knees that keep giving way. Not everyone needs surgery. Structured physiotherapy alone works for some people with lower activity demands or partial tears. In reconstruction, the torn ligament is replaced with a graft, a piece of tendon from your own body or a donor. The surgery is done arthroscopically through small incisions using a tiny camera and slender instruments inside the joint. Small tunnels are drilled into the thigh and shin bones. The graft is passed through and fixed in place. The first 2 weeks focus on protecting the graft, controlling swelling, and getting the knee fully straight again. Physiotherapy is the biggest part of recovery. It rebuilds strength, balance, and control over about 9 to 12 months. Return to pivoting sports isn't based on the calendar alone. Strength tests and hop tests help decide when it's safe. Risks include stiffness, infection, blood clots, and graft re-tear. Re-tear risk is highest in young athletes returning early. With committed rehab, most people regain a stable knee and return to the activities that matter to them. Did you know you can get this treatment abroad at the same quality you'd get in the US or Europe for a fraction of the cost?
Ginger Healthcare is one of the world's most trusted medical travel companies. It helps patients to find safe and affordable care in India, Thailand, Turkey, Singapore, Dubai, Malaysia, and more. Visit ginger.healthcare or check the description for details.